Okay, hi everyone. Good afternoon, good morning, anytime you are watching this video. It's evening, yeah. So as you all know, this mental health of it's evening, and today we will be talking about something very interesting. But before I go deep, before I start, like you all know, this program is brought to you by Grace Hill Behavioral Health Services and supported by the Grace Hill Healthy Mind Initiative. So this the purpose of this program is to create mental health awareness among people. So mental health education, if you want to know more about your mental health, this program is for you. So like I said, today we are going to be starting a series on substance abuse, addiction, and mental health. Like I always say, your mental health is very, very important in whatever you do. So if it has to, if it has to come to a point where you have to choose between your mental health and any other thing, to me, I would definitely choose my mental health, because without me having a good mental health, I don't think I can function. So we'll be starting a series on substance abuse, addiction, and mental health. It is very, very important. So before we start, so I'm going to be important. So it is no doubt that substance use and substance dependence, as well as poor mental health and emotional health, actually takes a big toll on every individual, and sometimes even family and the community. So when you see someone abusing substances or taking or is substance dependence, sometimes it does not even only affect the individual, it affects both the families and the community. Before now, I've talked about substance use in the family, and that video was really educating. So I would implore you to go to our YouTube channel. It's on our YouTube channel, so you can watch the video and understand substance use in the family. Like I said, when someone is taking substance or is into substance, it does not only affect the individual, it affects the family. It has a way of also affecting the community and the society. So it has so many effects that that will happen at the same time. So also before now, there have been various efforts by stakeholders. When I mean stakeholders, it also includes individuals, communities, both government agencies. So we have government agencies also fighting for substance abuse in the society, and also substance use prevention. So we have agencies like the NDLEA, that's the National Drug Law Enforcement Agency. We also have NAFDAC. We have the UNODC. They all aim to curb the use of substances in the society, right? So we have various stakeholders, even individuals and NGOs, also working tirelessly to ensure this issue of substance abuse in the community and in the society is curbed. So they do that through preventive measures. So they organize programs from time to time to educate the entire public and people on the dangers of substance abuse, right? So just as important, so prevention involves building mental and emotional health of individuals. So when we talk about substance abuse prevention, it helps build, an emotional and mental health of the individual by creating communities that support and encourage healthy development. Of course, it's a big job when it comes to the issue of substance abuse and awareness, prevention, treatment. It's a big job, it's a big deal. But the joyful thing is that we have so many people that are already working, and so many people that are also willing to work in various settings and capacity just to get the job done, just to ensure that this news of substance abuse prevention spreads around the world, right? So we are going to be looking at the statistics of substance use in Nigeria. For some time now, we've been having, there was a particular time we were seeing so many videos on social media on how young people abuse drugs, how people take drugs, and they were not even ashamed of doing it. So that's to tell you that the rate at which people use drug or abuse them in the society, especially in this part of Nigeria where we come from, in the southern part of Nigeria, is actually on the increase. So if you do your own survey, if you try to find out, do your own survey, you will discover that people on the southern part of Nigeria here, they actually use drugs more than those in the other part of Nigeria. So generally, around 275 million people use drugs worldwide in the last few years. So over 36 million people suffer from drug use disorder. So this report is according to the 2021 World Drug Report released by the UNODC. So I would refer you to that, to go to the UNODC site if you really want to know more about these statistics. Go to UNODC website, then you will see more. So, but moreover, we have most countries have reported a rise in the use of cannabis during the previous pandemic, during this pandemic, right, the COVID-19. So there have been a report, even in Nigeria too, when people were asked to stay at home and all that, people were bored, even the young persons too, they were bored. So there were actually an increase in the use of substance. So if you find out, you'll find out that cannabis is the most used drug. A lot of people use cannabis. Aside from alcohol, it's very, very common. People use alcohol a lot. But cannabis, people also, it's the most used drug, right? So there was even a rise in, an increase in the use of non-medical and pharmaceutical drugs. Yes, so many persons also abused pharmaceutical drugs, even those that the ones that were prescribed by their doctor or consultants. It was also abused. So generally, if you look at the World Drug Report, it actually provides a global overview of the supply and demand of these drugs, including cannabis, opioids, cocaine, and other stimulants and psychoactive substances, as well as the impact on the health, the impact on our health, right? So now let's briefly look at some findings. So while this report was going on, there were some findings that came out. I'm going somewhere, so just flow with me. So they discovered that the internet helped increase the rate at which young people take drugs. It is very, very true. So when you go on internet today, so you go on internet and you see a lot of things, a lot of young people wanting to experiment drugs, and the truth is, these young people, they already know a lot. When I mean young people, I mean from the ages of 18, 19 to 27, yes, 18 to 27, even ages lesser than that too, they tend to use drugs. I mean, I've seen videos, I've seen evidence of young people, very young children now, not even young adults, children trying to abuse drugs because they want to experiment it. So within the past few years, especially during this period of COVID pandemic, a lot of young people actually use drugs because the internet aided them. Then cannabis is also more potent, but fewer young people see it as harmful. So when a young person is trying to experiment with cannabis, they don't see it as it's harmful to their health. They don't see it as that. Probably, I don't know, maybe because they were really not oriented. But the truth is, it is more harmful than you think, right? So it is also very, very surprising that while other sectors are also trying to struggle and striving to get back on their feet after the period of COVID-19, the drug market quickly recovered after the onset of the pandemic. So people are trying to recover, people are trying to get back on their feet. So many businesses shut down that period, so many offices were closed, so many things were held on hold because of the pandemic. So but the drug market, there's something about the drug market of which I think I should make my findings. But the drug market, surprisingly, it was very easy for them to recover. That's to tell you the increasing rate at which people abuse substances, or at which people use these substances. So it is also the non-medical use of cannabis and sedative really very increased a lot during the period of COVID-19. So a global data also discovered that roughly 200 million people, wow, that's a whole lot, 200 million people used cannabis in 2019, representing a 4% of the global population. So cannabis, like I said, is the most used substance, followed by alcohol. Yes, a lot of people use alcohol, and a good number of them do not get addicted. When I mean addicted, they do not depend on it. I'm going to talk on substance dependence as we continue in this video. But some of them definitely also became addicted to using alcohol, while some were actually not addicted. They just use it and that's it. So cannabis is the most used drug, followed by cocaine. So half of the lifetime of people. So if you also make your own findings, you discover that half of the lifetime cases of mental health disorder begin by the ages of 14, and fourth begins at 24. So if you see a young person or a young adult abusing substances, they probably started at a very tender age, right? They started at a very tender age. So I've been privileged to speak with some young people, secondary school students, and I was amazed by what they know already. It was like, wow, so you know this much. Yes, because they know about these things. So there is a tendency that because they just want to experiment, and the inquisitive nature in them would want them to take it. So people with mental disorder and substance use disorder, they actually begin at a very tender age. That is why it is very, very important as a parent or a guardian, you watch closely what your children do. It is very, very important. So you can see more of these findings in the UNODC site. So when you go to the UNODC World Drug Reports, you will be amazed by the findings and everything about substances. So we have 30 minutes for this program. So I'm just quickly going to run through the various definitions. So just to establish something, like I said, this is a series on substance abuse, addiction, and your mental health. So many people use substances such as alcohol. It's actually it's no news. So people use substances such as alcohol. Alcohol, yes, it's a substance, it's a hard drug as well. Then they also use tobacco, and as well as over-the-counter medication at some point in their life. So at some point in your life as well, even as an adult, at some point you must have tasted alcohol. You must have tasted some other over-the-counter drug. Hey, it's fine, it's okay. But it is very important to know and understand the difference between substance use and substance misuse, or abuse and dependence. Now let's briefly talk about substance use. So substance use it's the consumption of a low or infrequent doses of alcohol or other drugs, such that the damaging consequences may be rare or minor. So when you use a particular drug, or when you use a particular substance, it's in low quantity. That's what substance use is talking about. So it might just include occasional glass of wine for recreative purposes. So you go for a party and you are giving a small quantity of alcohol or a glass of wine, just to while away time for recreational purpose. That is substance use, right? So the legal use of prescription medication, also directed by your doctor, is also substance use. So let's try and not mix these two together. So when they say you use substance, it doesn't mean you abuse it. I was having a conversation with someone on this particular topic some time ago, and during the process of our conversation, we got to find out that substance use, really, it's unlike the way some people think what substance use is. It's really, when you just use it, it doesn't mean you are addicted to it, right? So someone might be using a particular pain-kill prescribed by the doctor, doesn't mean the person is abusing it. So let's get the definition clear. Let's get it clear. It will help us to understand the basics of our series that will be running for the next within the period for the next few weeks, rather. So like I said, substance use is the low consumption or infrequent doses of drugs or alcohol. So if I get a small glass of alcohol or a small glass of wine and I take it, it doesn't mean I'm abusing it. That is substance use. I hope we understand. So if you have any question during the course of watching this video, you can drop your question or your comments. I will definitely see them and attend to them. Now, with that being understood, let's go over to what let's go over to what substance misuse is. Remember, I'm trying to give the definition of what substance use, substance misuse, substance abuse, and substance dependence is. So it will help us understand, really, in the course of this program. So substance misuse is the use of substance for the purpose not consistent with legal and medical guidelines. So when you misuse something, this term is often described as the use of prescription drug in a way that varies from the medical direction. So let's say, for instance, a drug was prescribed by the doctor for your friend. That drug wasn't prescribed for you, and you went ahead to take it. That is substance misuse. I don't know. Okay, so that's substance misuse. So when you use a particular drug or a particular substance for a purpose that is not consistent with legal or medical guideline, it is substance misuse. So let's say, take for instance, okay, I've given a scenario already. So another scenario is such as you taking more than the prescribed amount of drug. So you are given a prescription by the doctor, and the doctor says take one in the morning, one at night. Then you went ahead to take one morning, two afternoon, two night. You are misusing the substance because you are not following doctor's prescription. That is what substance misuse is. It is better we understand these terms, so we use them rightly. So we use them in the right context, in the right time, at the right place. It is very, very important. So I've communicated the meaning of substance misuse. So when you take a prescription more than the amount of drug you are supposed to take, or you are using someone else's prescription for a medical or recreational use. Now, some people are actually guilty at this. So you feel headache, or let's say, okay, perfect example. You feel you are having a symptom of malaria, and because you talked to your friend about it, and your friend had that kind of has had that kind of symptom, and the friend went to meet with the doctor, and the doctor prescribes some kind of medication, take this, take that, take that. So because your friend had the same symptom with you, and your friend had gone to see the doctor, and the doctor had prescribed a medication, you feel you also can take that medication without running tests. So what makes you think it is malaria that is your problem? So it might be something else. So you are misusing the substance because you are having the same symptoms as your friend. Doesn't mean you have malaria. It could be something else. So using somebody's prescription for medical or recreational use, it is substance misuse, right? So let's go over to substance abuse. Yes. So in fact, this issue of substance abuse, it's really a big topic in the society, because everywhere you go to, you hear substance abuse, don't abuse substance. Let us know the meaning of substance abuse today. So substance abuse is when a drug or alcohol is used and it causes adverse effect. So even if you are having some kind of adverse effect on your health and you keep using it, that is substance abuse, right? So abuse, for instance, can be used to describe the behavior of a person. You've had 4 glasses of wine in the evening, then you woke up in the morning and you had a hangover. That's abuse, right? So when you use something, when you use a particular drug, and you are seeing the adverse effects of that drug, that is not good for you, or it causes adverse effects, you keep on using it. That is substance abuse. So I'm going to be telling us, how do you know you are actually abusing substances? Because you can't just tell that someone is abusing substances without, noting out some points or noting out some symptoms over time. So you know you're abusing substance when you use a particular drug each time you experience a failure or a major change in your life. So it could be school, it could be at home, it could be at work. So when you continue using that substance, even though it wasn't good for you, even though it wasn't prescribed for you, and you've used it before and you continue using it, that is substance abuse. So you can take a particular substance to cover up, to shy away from something. Yes, to shy away from something. So recurrent substance related legal problems too. So when you begin to get into trouble for using a particular substance, so when you use a particular substance, for instance cannabis, so we all know that cannabis causes, for some people, not everybody, for some people, it causes some kind of it brings some kind of psychotic symptoms, yeah, for some people. So when you begin to get into trouble frequently as a result of using some kind of drug, so you've taken cannabis already, or you've taken cocaine already, and you're already getting high, and you get yourself into trouble, just know that you're on a path to substance abuse. Then continuous use of substance despite having persistent or recurrent social, mental, or however problem it is, so caused by the effects of the substance. So you have problems, you keep on having some kind of issues socially, mentally, like I said. Some hard drugs like cocaine, cannabis, for some people it causes some psychotic effects on them. So when you keep on having those things and you keep on using it, despite those changes that you are seeing, it is actually substance abuse. So substance abuse it's in summary, it is when a drug or alcohol, you use it and it causes an adverse effect, and you keep on using it despite the negative effects that it is causing you. So if you have any questions, you can drop them in the comments. I will definitely see them, then I will answer them. So our time is already fast spent. Let's briefly talk on substance dependence. Substance dependence is also referred to as addiction. It refers to as addiction. So it's a compulsive craving for a substance. Now, I've been able to differentiate between substance use, substance misuse, substance abuse, and substance dependence. So substance dependence, it's like I said, it refers to as addiction. It's also known as addiction. Excuse me. It is a compulsive craving for a substance. So even though whatever you are doing, it's not good for you, you know it's not good for you, but you crave for it, you can't do without it. That is substance dependence. So you are becoming dependent on that substance to survive your day-to-day activities. Yeah, your day-to-day activities. So people who are addicted cannot function normally without the substance, because their body already depends on it, either physically or psychologically. That is why you see some people, for some kind of jobs they do, without them taking a particular drug or a particular substance, they can't function, they can't do anything, because they are already dependent on that substance. Maybe as time goes on, I'm going to be telling us more, or talking to us more on some substances and how you can be dependent on them, maybe in future. But for now, let's focus on our series. Okay, so you can say someone, or you are drug dependent when you experience some few things. So how can you tell that somebody is dependent with a particular drug? So it necessarily doesn't have to be a drug or alcohol. But let's say, for instance, you like taking Coke. When I mean Coke, Coca-Cola, or maybe Pepsi, or any soft drink, and you discover that you can't do anything without taking Coca-Cola. So before you have to walk, before you have to do anything physically or mentally, you have to take Coca-Cola. That means you are getting dependent on Coca-Cola. It is the same thing as substance, right? So when you can't do anything without that substance, you can't go anywhere, you can't live. For some people, you can't breathe. So staying a day without smoking cannabis or sniffing cocaine, they can't. They are already dependent on that substance. So you can say you are dependent on a substance when you begin to increase the number of substance you take to get the desired effect. It's called tolerance. So now when you take a cocaine or cannabis for the first time, for instance, it gives you a very high feeling. It gives you that euphoric feeling, right? So the next time you may want to take it, you take your usual quantity. You may not get that euphoric feeling again. So you might need to take a higher quantity or a higher dose of that substance just to get that same euphoric feeling. So that is what substance dependence can do. So you discover that you begin to increase your dose. Okay, today you take 1 wrap. Okay, 1 wrap is good. Tomorrow you discover that you take another wrap, like 2 wraps. Next tomorrow you take 3 wraps. Before you know, you finish 10 wraps a day, and it's not even enough. Yeah, you're already dependent on it. You can't do anything. So your tolerance level begins to increase, and you just discover that you need more of that substance to function, right? So just know that with that symptom, you're already tolerant and you can't do without it. You definitely need professional help at that point in time to stop. Then when you begin to have some withdrawal symptom anytime you stop taking that drug, like some people, they usually have a very, very bad withdrawal symptom when they stop taking a particular drug, or when they stop taking alcohol. For those people that are addicted to alcohol, each time they try to stop taking it, they have this bad withdrawal symptom, as if they would pass out if they don't take it. Then you're already dependent on it. Just so that you're already dependent on it. So even if the effects on you, the effects of the substance is really bad on you, you still want to take it because you are scared of having withdrawal symptoms. At that point also, you really need professional help. You need a professional to help you go through the journey of recovery from substance the stuff. So you also know that you are dependent when the substance is taken often in larger amounts over a long period of time than intended. So you intend to take a bottle of stout. Let me put it that way. You intend to just take one bottle of stout. Then before you know it, you just see yourself taking 1 crate. I don't know if anybody can do that, but some people can actually. So you just see yourself taking 1 crate and you'll be like, oh, did I really do this? Like I said, tolerance. The more you take it, the more your body needs it to give you that euphoria, that feeling of euphoria. So you keep on increasing the dose. You're already dependent on it. So you also discover that when you begin to get dependent on substances, you begin to spend a great deal of time. You begin to do whatever it takes. You must get that particular. So I've seen people, I've seen some cases when they can go any length. I was watching a video the other day and the girl was like, okay, she went into prostitution because she wanted to get crack, and the person that was actually giving her stopped giving her because he wanted money and all that. So because she couldn't afford it, she started prostituting, selling her body and all that, just because she wants to get that particular substance. So that is what substance dependency can do. That's what addiction can do. So when you see someone that is craving for a particular substance so bad, maybe cannabis or cocaine or anything, they can do anything. They can even sell your house. They can sell your house. They can do anything. They can go any length to ensure they get that particular substance. So when you begin to have that kind of feeling, and you want something so bad, you can go any length to get it. Just let's just know that you are addicted already. You are already dependent on that stuff. You also need professional help. Then also, when you begin to forfeit or reduce the importance of social gathering, family, friends, okay, the things you love doing before, you no longer want to do them. You just want to be on your own. You just want to stay indoors and with you and your weed, your cocaine, or whatever it is. That's a signal. Then also, you also continue using the substance despite having a persistent physical or psychological problem. So like I mentioned earlier, for some people, they usually have psychosis when they use cannabis or when they use cocaine. So it affects their mental states. It affects the way they reason, the way they relate with people, for some people. So even though that substance is giving you that feeling, it's affecting your psychological being. It's also affecting your physical being. So for some people, when you see them, they are taking hard drugs, they will be looking so lean. They will be looking malnourished and unkept and all that. And they are seeing themselves that they are not looking fine. Their body is not looking okay. But they will still keep on taking it because they cannot do without it. For example, so some persons usually take cocaine. So despite the feeling that cocaine gives, it makes you feel, some people it gives them some psychosis, like I said. They will still keep on taking it. So that's what substance dependence is. So please try and note the difference between these two, so we use them in the right context, right? So like I said, when you discover that you can no longer do without the stuff, the dose you are taking is increasing. You are actually being dependent on that substance. And at that point in time, please get professional help. It is very important to get professional help so you will be back on your feet. So our time is already spent. So sorry I took like 5 minutes of the time extra. This program is supposed to be for 30 minutes, 3 p.m. to 3:30, but we're already using more than the time. So thank you so much for joining in. So this is a series on addiction and substance abuse, addiction, and your mental health. So join me next week. We are going to be talking about a very important topic still on this series of substance abuse, addiction, and mental health. So I've given us the basics already for what we really need to know. I've established the basis, so when we start the series proper, you won't be caught unawares when I start using some terms and some grammar. Let me not say grammar, but some terms you will understand better. So thank you. If you have any question, you can drop it in the comments below. I will definitely see them, then I will attend to them, I promise. And thank you for joining in. So some people joined. I'm seeing some familiar names. Thank you for joining in. Please make it a date with us next week. Thank you. So for our previous videos, so you can go over to our YouTube channel, Grace Hill Behavioral Health Services. We have a lot of videos. So videos I've done on mental health talk with Evelyn, they are on the YouTube channel. So you can go over to our YouTube channel to watch those previous section on mental health talk with Evelyn. We also have other videos there too that will be very, very educative. We have love and mental health. We have question and answer with Dr. Edebi. Very, very interesting. So make it a date with us next week, please. I can't wait to see you. Thank you and have a great day. Bye.